to lose your hair, you just, to me, and I think maybe to many other people, you're losing more control over what's happening in your life. I think that when you have that diagnosis, you do lose so much control. You've got appointments to go to, you've got people telling you that you have to have this treatment, and you just basically are handing everything over. To keep your hair, you're keeping that bit of control. It's something that's not going to define you as such. You're going to still be who you want to be.
Like a lot of people, the first thing you think of is cancer is, oh my God, my hair's going to fall out, which is a little bit of vanity, a little bit of dignity, and a lot of practicality. People see you with a bald head and they think, oh my God, there's someone that's very ill there.
There's something about losing your hair which is a very visible message to the world, which means that you are going through a particular process of not being well, or going through surgical or going through chemical treatment, which for some people has a big impact on identity and self-esteem and a feeling of not being in control.
When you talk to particularly females, and often now you have young breast cancer patients who will talk to you quite openly about the fact that whilst they're going through such a difficult period of treatment, the fact that they know that they've got one less thing to worry about the impact of it on their social setting, for example, means that they have a better lifestyle choice to make.
Scalp cooling offers patients a sense of control over their disease. They don't have a control normally, but this is one element that they can. It gives people psychologically a greater impact on the disease process and the journey that they're going through, that they are able to try to keep their hair, which gives them a sense of normality. And really for both patients and staff, it's a sense of reassurance in the whole of this journey.
A lot of patients, whilst they're more accepting perhaps than the past of the diagnosis of cancer, still want to keep it often private. They don't like to have the visual reminder for themselves, their family, friends, work colleagues, that they're undergoing treatment. And of course, total hair loss in someone that normally has a full head of hair is quite a visible reminder. So with scalp cooling, particularly when it's effective, patients are spared that extra distress on top of all the other side effects of treatment and diagnosis.
The first week they said it'll be like brain freeze, like when you're at a very hot beach and you eat a cold ice cream and it goes bang, and they said it'll be 3 times as bad as that. And on a scale of 1 to 10, it is no worse than a 2. And after the initial 5 or 10 minutes of sitting there with a cold cap on, the cold feeling goes away completely. You are slightly numb, but you don't feel it at all.
It was such a surprise, obviously, when I got diagnosed. It was a massive shock, and then to know that I've got to go through all these treatments and surgeries and things like that, and then to thinking that you're going to lose your hair, and then someone tells you, actually, you could try this, and you're not going to lose your hair if you wear this. It made a big difference, and to know that there is something out there that can actually prevent people. And I think that's maybe a massive worry for so many people that have the diagnosis. They hear the word chemotherapy and they think, I'm going to lose my hair.
Hi, my name's Claire Paxman and I'm the UK Sales and Training Manager. So my dad Glenn developed our Paxman system after my mum lost all of her hair having treatment for chemotherapy in the 90s. And for her personally, it was the worst point of her whole treatment. It was actually the first time that she cried when her hair started to come out. Me personally, it was a very devastating side of it also. I actually cut all of her hair off when I was 14 years old. My mum's hair was just like mine, naturally curly. It was a very big part of her. So to stand in a bathroom with the orange-handed scissors from the kitchen, cutting all of her beautiful hair off, which meant so much to her, was something that I will never, ever forget.
My name is Glenn Paxman. I'm the chairman and founder of Paxman Coolers. I became involved in manufacturing the cooling cap many years ago now, back in 1992. The amount of letters we received just saying what a difference it made to their lives, the fact that they could keep their hair. Because it is the most, outstanding side effect of cancer chemotherapy. It's the most devastating one. The self-confidence, the self-esteem, the positive attitudes. There's a list of many things it has an impact on the patients if they lose their hair. Well, we're now stopping that happening. We're letting people live a normal life while going through this treatment of chemotherapy, which makes us feel wonderful, and it's part of our drive, part of our passion, part of our branding, embracing life, and that is what we're doing.
My name is Richard Paxman, CEO of Paxman Coolers Limited. Paxman was established in 1997, so we have over 15 years of experience in the medical industry. So we are known as the world's leading expert and manufacturer of scalp cooling equipment. So we have over 2,000 systems in the world, 900 of those being in the United Kingdom. Scalp cooling is becoming a standard treatment practice within the UK, with 80% of all private and NHS hospitals adopting the technology. An important step for the business is the biological work we're doing. So this is really understanding more about the mechanisms behind chemotherapy-induced alopecia, but also scalp cooling and those working together. If we can understand these mechanisms better, we're then able to improve our results, improve efficacy, and that will be a huge benefit for the patient, but also for the business growth.
My name is Dr. Nick Georgopoulos. I'm one of the biology lecturers at the University of Huddersfield. When it comes to how scalp cooling works as a principle, several hypotheses have been suggested. No one knows exactly how it works, but there are various potential hypotheses that have been suggested. One way that we believe it works is by inducing vasoconstriction, reducing the size of the blood vessels. As a result of that, when the chemotherapy drugs are in the bloodstream, because of vasoconstriction in the scalp area, less drug is believed to go to the actual hair follicles, which is where the toxicity takes place and hair loss as a result occurs.
The other thought is that the membranes of the cells in the hair follicles, are the ones that are actually potentially going to be damaged by the chemotherapy drugs, are less permeable to drugs when they're cool, so less drug gets into those cells. Also, it could be that the cell's metabolism slows down, and particularly the rate that they divide, and that will mean, because most of the chemotherapy drugs target rapidly dividing cells, if you can slow that process down, then they'll be less toxic.
So it could be one of these mechanisms, but we believe it could be a combination of these mechanisms.
Once they start treatment and they're using scalp cooling, they realise they're not going to get total alopecia, and they grow in confidence in how the treatment's progressing, how the family are dealing with them, and it's just one of their main concerns is removed. So I see this sort of confidence that develops during their treatment when the scalp cooling's working.
I went to my cousin's wedding, which I was bridesmaids for, just as treatment had finished, and I was obviously in all the bridesmaids pictures, and I wouldn't have done that if I'd lost my hair. I wouldn't have wanted her or myself to have that constant reminder on her special day that I was a victim of cancer at the time.
They hear you're suffering from cancer, they expect to see you looking drawn and terrible and bluntly bald, and when they see you with a full head of hair looking fairly robust, they think, my God, you're not suffering at all. So it's great that I can walk into a room with no sense of disability whatsoever. I'm just normal, and that's massive, because I'm undergoing cancer treatment for cancer. You never know what's going to happen, but for me, I'm just a normal guy now.
Psychologically, for me, it was really important both times. First time when I had the breast cancer, it meant I could go out and work and nobody needed to know that I wasn't well. I have wonderful clients and key people in my client companies knew and understood that I was going through treatment, but many of the people who I went out and trained had no idea at all. Although subsequently I've actually talked about it, because I make a point of telling people. I think cancer and the treatment of cancer, and understanding that in this day and age we're incredibly fortunate in relation to what the medical profession can do, and Paxman scalp coolers, enabling people to continue to live life to the full at a time when you're not feeling your best.
Reassuring.
Confidence.
Innovation.
Reassurance.
It saved me my dignity.
Fantastic, awesome and brilliant, and that spells fab.
We believe that all cancer patients who are having to have chemotherapy which causes hair loss should have the choice of trying scalp cooling to help prevent the hair loss. So Sue's legacy will live for a long, long time, and we're going to make it work.